Good to see you all. I'm Vice President of Hyutom, Lee Dong-myung. And I came here and listened to others' previous presentations, and you may find our item unfamiliar, so I would say 20 minutes isn't enough to explain everything. So I'll just give up on explaining everything in detail, but so I'll just rather choose to enable you to remember what our company is. So our presentation theme is reshaping surgery through digital innovation. So patient caring platform from reshaping surgery. And nowadays, using AI is a very obvious, like of course, item nowadays. So instead of talking too much about AI, I'll rather focus on our company's identity. So when it comes to diagnostic AI, we rather focus on something else, like in surgery and before surgery technology. So there will be some videos in the video. So I would like to ask for your understanding if you are not used to graphic image. So there's this platform to help out surgeons. Here is the table of contents. A company introduction and our AI solution, core competency and growth strategy. Originally, I had over 100 pages, but because I have 20 minutes, I just chose the most important parts. The market needs is like this. From a patient's perspective, 1 in 5 or 1 in 4 people eventually get cancer, and there needs surgical intervention. So when it comes to market size, the market size is really expanding in a rapid way. And when a patient gets cancer, then that patient would use all his efforts to find the best surgeon in his social circle. And after surgery, the chance of getting complications after getting a surgeon, it differs between patients by almost fivefold. Even getting a fever is also considered a complication, and patients are reportedly have complications with 50% of chance, and those suffering from complications and not, they have fourfold of different afterwards medical expenses. And here at the graph, it shows the medical treatments and the history. So the first is laparotomy, and the middle one is laparoscopic surgery, inserting camera and the human body and seeing the monitor to conduct surgery. And instead of laparoscopic, you could insert a robot, which is a robot surgery. So when you see the vertical graph, you can see a quantum jumping. The outcome of the surgery done by surgeons is increasing. So by each generation, the result level is quantum jumping. And after adoption, since the adoption of robots, nowadays we're shifting to digital operation. This is data-based surgeon. In the past, surgeons were they had to learn manual operation from their tutors, but nowadays surgeons can make use of AI or other data. They can refer to the collected data to conduct operation. And here it does not show a flat rate, but you can see that the gap between surgeons is decreasing. So even those highly trained surgeons or not so highly trained surgeons, the results will be very similar to each other. So our goal is to foster a fair surgical environment. Next slide. I'll just skip this slide as well. So I would like to categorize my company's characteristics into three. So first is medical infrastructure. So we have Professor Hyunwoo-jin, who is managing director at Yonsei Severance Hospital Oncology. So he has the best gastric cancer related data, and Professor Lee. So he has like a reach, a boundary of data, and I'll skip explaining the second one. If you take a look at the third one on the right, is AI technology. So I would say we have number one technology. So not only diagnosis, but the entire surgical procedures will be video filmed with our technology. So AI vision technology is our key, and I would say we are number one in of its kind in Korea. And even if you include the overseas market, we also have a very strong strength. So at the Mika Challenge, so there's a global competition, and we awarded the first prize, and the second prize went to Facebook. So we have the number one technology worldwide, and the basis of having this number one is thanks to our AI infrastructure. AI should annotate data well in order to get smarter and smarter. And based on our medical data, we those normal annotation data can't work it by itself. Medical doctors have to process the data. So they studied what kind of surgery resulted in bleeding, and from A to Z, what kind of those 11 steps were like. In what sense were they different? So they conducted some cross-checking to come up with data. So we have the most richest data in the world. That is why we were able to rank number one in this field. So now I only have 10 minutes left. I also do it quick. Professor Hyung wasn't able to be here, but he works at Yonsei Severance Hospital, and um we are currently working on Series B, and I'll move on to the next slide. In 2017, we found our company, and we have been accumulating our technology. And since 2020, we began commercializing. We did GMP certification or ISO 13485, or conducted clinical trials, and now we're working on Series B investment. And we completed a domestic clinical trial in Korea, and we're working on clinical trials in multi nations in 11 hospitals worldwide. And this year, we are planning to get our technology assessed at NECA. And I'll skip some slides again. So probably now you have a gist of our identity. And here I can categorize the overview into three. One is the solution before surgery. The mid one is in the middle of the process, so intra operation. So the service that we provide in this process, and the very right one is after completing the surgery. We do provide additional service after operation. So we have about 4 to 5 different services. But since I do not have enough time to explain all the five in detail, so I'll just focus on this RUS navigation, AI aided navigation technology. So this RUS, I'll explain it on this slide. So RUS, as when a patient has to go through a surgery, then of course he must have been diagnosed with cancer. Then you conduct a CT image. So you film about 400 photos, and if you upload the 400 images on the platform, and you can use this actual product to recognize the anatomy data. So why is this recognizing process important? Is that when a camera robot actually went into the body, And this one has to do with like laparoscopic surgery. So it's like you cut the body part and inject a robot, and then it gets out, and you sew it. So it's a sort of operation of saving the blood vessels. So doctors actually taking a look at the organ is less than 20 minutes, but the rest of the time spent is um, about the problem about if the patient would survive or not after cutting the organ. And just like humans' fingerprints, blood vessels differ between people and people. And when a camera robot enters the human body, people would imagine that the camera would show clear image. However, because of fat in the human body, it's like driving a car without turning a light on. So please click the left bottom one to play the video. So there are three different videos. If you see the video, then you will have a gist on it. Well, it looked like it was going to work. Well, then, uh, could you please play the second one? It doesn't work. It's a shame. That was the most important part of today's presentation. Next slide then. Well, I'll just explain verbally then. So I'll explain based on the left photo here. So when a patient enters a operating room, of course you won't remember what had happened because you get medicated and fall asleep, and patients are not allowed to enter as well, right? So nowadays, when you use your robot technology, medical doctors do not look at those physical bodies of patients, but instead they use a console box, just like playing a game, a video game. So they operate that and operate a robot so that the robot inside the patient's body does the operation. So those medical doctors, how do they see the video in it? Here is a robot inside of the stomach. So they're looking into the graphic provided by our technology. So there are this kind of vessel hidden here, and after cutting this, then they have to take a close look here, or they have to clip this. So those medical doctors are guided by this medical system. So from since last year to March this year, we conducted a clinical trial on 36 different samples, and we're about to publish a paper on this. So when you watch this video, then you can intuitively understand the procedure, but it's a shame that I cannot play this. Actually, in Singapore, there was an actual case where we provided a service to a Singaporean patient. So I was planning to show you that video as well, but maybe next chance. And this is the after surgery video. Could you please see if this video plays? So this is a post surgery. Well, if it doesn't work, then forget about it. So when you finish getting operated, then meanwhile you'll have video instead of video robot instead of you, and it will be video filmed for 3 hours. And when we upload that video on the video platform, then the artificial intelligence analyzes that video clip and gives us information that because the surgeon got lost in the middle of the surgery, so probably the patient will have some complications. So they're like with the chance of X%. And based on that report, the medical doctor can focus and concentrate on the risk of it so they can get rid of the risk. So that is surgigram. So one example is that after a patient um, went to a hospital, I said the chance of getting a complication is 50%. Like even getting a fever is a sort of complication. And then surgeons will think there must be a specific reason that a patient got a fever, but they cannot open the human body again, and they do not have enough time to play the video for 3 hours to find out the reason. So the AI jumps in and does that analyzing part. So they recognize and the anatomy data. So there are from step 1 to 21 when conducting this surgery. So there are like 15, 16, and 17 phases. So the AI does the phase-based recognition. And this is the before surgery service. So because of recognizing all the construction, thanks to this visual reconstruction, medical doctors, surgeons can practice the surgery. So in the past, no matter how skillful you are, you have to conduct practice surgery on actual body. So only one practice was possible per body. But nowadays, thanks to this platform, you can practice over and over again. And here are competitors of our company. So there are visible patient assist tests, care syntax, and surgical science on Olympus. But we're the only company that has an entire process service for before, amid, and after the surgery. And as I mentioned earlier, um, in terms of quantity and quality, we, in terms of medical surgical data, we have a lot of sufficient data, which is beyond compare to other countries, companies. So we have been recognized at the global level. So we have a very competitive edge. So Hitam, like I boasted a while ago, we ranked number one, and Facebook ranked number two in this field. And since the moderator wants me to wrap it up, I'll do my best. So, worldwide, the number of arm cancer cases is increasing by 50% every year, and nowadays, the medical expenses for this surgery is increasing by 3 or 4 fold. And people would say, if you like conduct surgery of opening your stomach, then people would say, ah, that's a severe condition. But the number of available surgeries is over 1,000, and nowadays available is over 10 million. And we are aiming to account for 5% of the entire market share within 5 years, and then later on we will increase. Next, we will move on charging patient by patient model. So we will adopt the SaaS model. Currently, we finished developing this on an oncology level. And there's kidney cancer, hepatobiliary pancreas, lung cancer, and colorectal cancer are the stages that we'll take. Thank you for listening.